What if we tell you that a sleep disorder killed this popular music composer and singer? Obstructive sleep apnea is one of the most common types of sleep apnea that is seen. Snoring is one of the most common sign for it. So what is sleep apnea? How can you then diagnose that you are indeed suffering from sleep apnea? And how can you treat it? What are the symptoms? This video is going to tell you all. Sleep apnea is a serious sleep disorder where breathing stops suddenly and then restarts. This happens when the soft tissues supporting your throat and tongue relax, which causes your airway to close momentarily, cutting off breathing. The time when the breathing stops completely is called apnea. There are three main types of this disorder. One is obstructive sleep apnea. This is more commonly observed and happens when your throat muscle relaxes and cuts off breathing. The other one is central sleep apnea. This happens when your brain can't send proper signals to the muscle that controls your breathing. The third one is complex sleep apnea syndrome. This happens when you have both central and obstructive sleep apnea. Well, do you suffer from it? You by yourself might just not recognize, but you can ask your bed partner if he or she is seeing any of these symptoms. Loud snoring is one of them. Episodes in which you stop breathing during sleep, which would be reported by another person. Gasping for air is another symptom. Awakening with a dry mouth. Difficulties staying asleep. Excessive daytime sleepiness. Difficulty paying attention while awake. Night sweats and irritability. Does sleep apnea pose a serious threat to your life? It is a disease that can lead to more serious complications if untreated. Take a look at what doctors have to say.
Usually the patient will present to us with the complaints of snoring, excessive daytime sleepiness, headache, inability to concentrate, and at times having made accidents while driving and falling asleep.
In India, more than 40 lakh people suffer from obstructive sleep apnea. Listen to what doctors have to say.
For diagnosis still remains polysomnography, or which is called a sleep study. So the common factors which contribute to it include the obesity, alcohol addiction, smoking, any obstruction in the airways.
How is sleep apnea treated then? For milder cases, doctors would prescribe you different treatments, including lifestyle recommendations. For more serious cases, doctors recommend continuous positive airway pressure or CPAP machine. This machine is worn while you're asleep to help you breathe continuously. Sleep apnea requires diagnosis. And if you or your bed partner notice any of the symptoms that we just mentioned earlier, then you must immediately consult a doctor.